Welcome back to Did You Know, a podcast by Partner Veterinary. In this series, we dive into everything veterinary medicine and everything partner. In each episode, we tackle some of the most common questions we hear, from HR to emergencies and everything in between. If it happens at Partner, we'll talk about it. Today, your pet could save a life. You've probably heard about blood donation for people. Maybe you've rolled up your sleeve yourself. But did you know that dogs and cats can be donors too? And that somewhere out there, another animal's life might depend on it. From emergency surgeries, to cancer treatments, to trauma cases, donated blood is quietly saving animal lives every single day. And most pet parents have no idea these programs even exist. Here to pull back the curtain is Dr. Pierre Charlebois, critical care specialist at our Richmond location. We'll cover what animal blood donor programs actually are, why they're so critical to modern veterinary medicine, which pets make good candidates, and what the donation process really looks like. So you can decide if your dog or cat has what it takes to be somebody's hero.
My name is Dr. Pierre Charlebois. So I'm one of the staff criticalists, one of two staff criticalists at Partner Veterinary in Richmond. So my role is mostly, there's a couple of different folds into that. One is I look mostly after the patients in the ICU, the intensive care, and I support our ER doctor on the ER side of things when they have some weird and wonderful cases. But then on top of the sort of clinical aspect of my work, I take on a lot of roles just to try and help, if I can, other services or help the hospital sort of elevate the medicine if I can, start programs like a blood donor program or antibiotic stewardship and things like that. So things that we can kind of all benefit as a collective hospital.
Thank you so much, Dr. Charlebois, for speaking with me today. And today we are going to talk about blood donor programs for pets. Can you start by explaining what an animal blood donor program is and why this is so important to veterinary medicine?
Yeah, so a blood donor program is in our veterinary world is going to be pretty similar, but on a smaller scale as the human world. I think that the misconception is that animals don't necessarily need as many kind of tools and resources as people. But the reality is that a lot of our patients need blood transfusions. And the unfortunate part of that, it's much more difficult for us to get those resources in a hospital setting. So I think that these are critical for us because you think about a lot of patients, population that need those. In the human world, you just have a big stock or you can order some very quickly. But for us, where a lot of us are, if we don't have a blood bank that you run yourself, or you're reliant on some companies, kind of regional companies to ship those. But just to give you an example, we have standing orders to basically get blood products as soon as they can. And sometimes we don't get any shipments for weeks or sometimes months. And so it's unpredictable supply, which then the patient suffers if we don't have the tools to treat them. So it's really critical for us, especially in our size hospital, that we receive the sickest patients in the area, that we have the tools to treat them properly.
What types of emergencies or medical conditions typically require animals to have or receive blood transfusions?
Yeah, it's really wide spectrum, both from a sort of medical side or a surgical side. And so the types of emergencies or medical conditions, the ones that are the most obvious are going to be things like patients that commit with vehicle trauma, right? So you get hit by a car, you might have some hemorrhage, or other patients would be things like patients that have tumors that bleed, right? So whether they have external tumors that kind of rupture and start bleeding excessively, or more commonly for us, almost on a weekly basis, older dogs that have abdominal masses or tumors that just rupture and they have a huge amount of blood loss. And to be able to save some of these dogs to have the option to go to surgery, a lot of them need blood transfusions to survive the surgery for us to stop the bleeding. So those are kind of the most obvious ones, but then there's a lot more kind of medical issues as well. So there's a lot of immune diseases that will either break down your red blood cells and make you anemic, or that will break down your platelets and make you have a propensity for bleeding. So all of those patients, they're very transfusion dependent until you can get their disease under control. And similarly, there's a lot of bone marrow diseases in our patients, same as humans, that make your bone marrow not work super well. So they're often very transfusion dependent to keep them alive for a few weeks or months until treatment hopefully starts to work. So I would say those are probably 90% of our patients that need transfusions. The other ones would be kind of the less common toxicities or gastrointestinal ulcerations that bleed a lot, surgical complications, those kinds of things. So it's very wide breadth.
Well, and as you're going through this, it's a lot more common than you would think.
Very much so.
What are the basic requirements for a dog or cat to become a blood donor? And can you walk us through some of this?
Yeah, so every blood bank is going to be they're going to set their own criteria. So we as a veterinary world, there's organizations that have come together to make suggestions and recommendations, but we don't have any hard set guidelines. So we all kind of get together and say, look, I think based on medical information, medical knowledge, and research, here's the best recommendation we can have. So the basic criteria for a dog or a cat are going to be slightly different, but in some ways similar. So you want young, healthy donors. So for instance, dogs that we are recruiting, they have to be between the age of 1 and the age of 8. And that's just because those, as you get above that age group, you tend to have a little bit more silent diseases, kind of geriatric diseases that will sneak up on you. And our main priority as a blood donor program is, yes, we want to save patients, but we want to do everything we can to preserve and protect our donors as well. So we do everything to prevent any risk to them. So their age is important, and it's the same age for cats. Their weight is also important because obviously we collect the same amount of blood for every canine patients. And so whether you have a Great Dane or a Chihuahua, you would have to collect the same amount just by virtue of the blood collection bags that we use. And so there's a minimum weight, so that's which is 23 kilos or 50 pounds, just because dogs smaller than that, they're a little bit higher risk of collecting too much blood, and then you can get issues for that. Whereas cats, the absolute minimum is 4 kilograms, but really we're looking at 4.5 to 5 kilos at a minimum to be comfortable, which is 10 pounds or more. And then on top of that, from a physical perspective, obviously they have to be healthy with no chronic illnesses, no chronic medications. And we're also looking for patients that have a good temperament, right? The last thing we want is to have a dog or a cat and, be miserable and stressed and anxious and fearful to collect blood, because that's not what we want, right? We want patients that need very little, if any, sedation to make them amenable to collection, because we want this to be a positive experience for them as well, right? Like, we can't ask them to volunteer their time and their blood. Right. And so we have to sort of do everything we can to make them happy and comfortable, because then it becomes sort of a moral issue, right? And we don't want to go down that road. And so those are kind of the minimum requirements, I would say, for these guys. And obviously we want them to be up to date on vaccination and deworming and heartworm prophylaxis, because just generally making sure they're healthy.
Do dogs and cats have different blood types like humans do? And how does that affect matching donors with recipients?
Yeah, it's a great question. So every animal is going to have their own blood type. So the same way that we have our blood types as humans, cats and dogs will have their own as well. And so, for instance, dogs, their antigen, or sort of what makes up potential reactivity in their blood cells, is classified as a DEA, or dog erythrocyte antigen. And it goes, there's many of them, DEA1, DEA7, there's a host of them. But what we're finding is that DEA1 is by far the most important. That's going to cause potential immune reactions between the donor and the recipients. The other ones some blood banks will test for as well, but from a clinical perspective, they're not nearly as immunologically important. They don't tend to react as much, and it's also much more difficult. Some of them you can't, or it's very hard to test for them unless you're in a research setting. And kind of similarly, cats will have their own types, which are type A, type B, or type AB. That being said, the vast majority of cats in North America are type A. Type B, and especially type AB, are basically very, very low percentage of these guys. So we test for the ones that have the most clinical relevance to make sure that the donor is going to be matched with the recipient.
And does breed have anything to do with being a good donor or not a good donor?
Yeah, so being a breed specifically is not a pro or a con. There are certain breeds that are more predisposed to certain blood types. So for instance, we know that ragdoll, kind of one of the purebred cats, they have a much higher propensity of being blood type AB, which has some consequences in, which patient you could or could not give their blood. And so from that perspective, there are some breed that may have a higher chance of being a atypical or less common blood type. Not to say that we can't use those patients, but we just have to be cautious, and that's why we test for them. And similarly for dogs, there are dogs that, for instance, there's blood types of which most dogs are very positive for, but there's a few breeds that will be negative for that blood type. And so we have to be a bit careful for that. So none of that are exclusive, but it's all in testing your patient and being aware that those are possibilities. But I would say any patients that amenable, we could definitely test for and have them in the program.
And when it comes to screening and testing potential donors, what do they have to do before they're approved for the program?
So it's not a super complicated process. I think step one for donors is, if owners are interested in participating or having their animal participate, is just really to kind of reach out to us, and sometimes even a phone call or a meeting in person, and then we can talk about the kind of the pros and the cons and the process, just to make sure that everybody's comfortable and aware of everything. And as far as the patient, step one is a physical examination by a veterinarian. Typically it's going to be on that day as well, but they also have a physical examination before any donation. So if everything seems very healthy and we go through their history to make sure they don't have any historical issues, whether it's illnesses or medication or otherwise, that would prevent them from being donors. If all of that step one checks out, then we go to the next step, which is testing for infectious diseases. So just like in humans, whereas in humans, they test your blood donation every single time you donate, it's not really something that we do in veterinary medicine. It's super cost prohibitive, and so it doesn't really work for us. So instead, as a surrogate, we test all these donors on admission to the program, and then annually, as long as they are donors after that, just to make sure that they don't get infected with anything. And on top of that, we do annual blood work and urine tests for dogs and fecal tests for dogs. And that's more for making sure that the donor remains healthy for donation. So we'll do those annually as well.
When it comes to people who are interested in being potential donors and these parameters that they must meet, is there a fee for that, or is that covered under the donor program?
Yeah, so we would cover that. So what we are in our program, and every program is going to be different. So for us, there's no fees for the owners. There's nothing to disburse. And we have some great perks that we have also for the patient. So if you bring a dog to us for the program, we will blood type it, we will do the blood work annually, and we will do the infectious disease testing annually at our cost. And so for us, we take on that cost because we get the benefit of having donors and being able to use that blood to treat our patients. So those are no cost to the owners whatsoever.
Is there typically enough supply to meet the demand?
Yeah, no, there's often not for large hospitals. And so what a lot of hospitals have done when you're in a smaller setting is you may have some of your employee dogs or employee cats that you test ahead of time, and they're kind of on standby at home. They're on call, basically. So if you have a patient that comes in and needs a blood transfusion in the next couple of hours or a day or two, then you can just bring that patient, collect a blood bag, and then give it to your patient. For us as a referral hospital and primary emergency, we don't always have that luxury to wait for those donors. If we don't have a fridge that's stocked and a patient comes in, there's a potential fatal consequence for that patient if we don't have the supply for that. And because our orders, we always have standing orders to get more blood and purchase more blood from companies that supply it, it can run dry every week or every month. And so if we don't have that program running and doing our best to stock it, that becomes an issue. So that's part of why we started that blood donor program here.
Okay. Can you walk us through what happens when somebody brings their pet in for a blood donation appointment? What pet owners can expect?
Yeah, it's going to be very similar. For any human that goes to donate blood every now and then, it's going to be pretty similar. So so typically we'll meet and then we'll go through a blood donation day questionnaire. So either myself or a different veterinarian or the technician or the nurse that's in charge of the program, they'll meet with the owner and go through the questionnaire, which just gives us an update because we don't see these patients for sometimes a couple of months in between donations. We want to make sure that they're still healthy, make sure that they're not on any new medications we should know about, that they're still up to date on their vaccine, their prophylaxis, and kind of any relevant history that may have changed. And if everything on that perspective checks out, they'll get a fresh physical examination by the doctor. We will test their blood for their red blood cell level, just to make sure that they don't have any anemia before we collect a blood donation. And if all of that checks out, then typically we will bring the dog back with us, and we need maybe 20 to 30 minutes or so. We'll shave a little square from their neck because we go for the large vessel in the neck called the jugular. We put some topical anesthetic so that it freezes the skin, and then we collect the blood bag. And after that, we just have to keep a wrap on it for about 20 minutes or so. And the dog usually can go home after that. And we just ask to keep the dog quiet for the next 24 hours while, their blood regenerates and the fluid redistributes in the body. Owners have the options to be present or not, and I think some of that is going to be a little bit of trial and error. Some dogs donate much better with the owner. Some dogs are going to donate, they're more stressed and agitated with the owner.
Yeah.
So it's a bit of a trial and error, and then over time we find the right cocktail and the recipe for success for these guys. Cats are a little bit, they're similar except for the donation part, because obviously they're cats, they're like little ninjas. And so sometimes, unless you have a really, really laid back cat, we tend to have to use sedatives a little bit more aggressively for these guys. So the cats, we do place an IV catheter because they are smaller as donors. We don't have the luxury of being able to get blood from a tiger-sized cat. So we do place an IV, and after we collect the blood, we replace some of that fluid with some IV fluids, which we don't need to do in dogs. So cats are typically there for a few hours, as opposed to dogs that are a little bit quicker in and out.
Are there any drawbacks for pets when it comes to donating?
There's not really big drawbacks. I think that the things, just like any medical procedures, there are potential adverse effects or risks. And for the case of blood donation, the things that I always try to warn any owners with their patients that are donating is things like reactions to the scrub, right? So the antiseptic scrub, just like if they're allergic to chlorhexidine or iodine or whatnot, we'll know that after the first time, in which case we would use a different antiseptic the future time. The risk of course, getting what's called a hematoma. Sometimes you collect to put your needle in the vessel, and despite your best effort, it makes kind of a little blood bubble, and then we have to abort the collection because we have to stop that hematoma by putting pressure on it. Neither of those are life-threatening. They're just more initial kind of aesthetic and discomfort ones, and then they don't prevent them from donating again in the future. I think very, very rarely, but potentially more important, is obviously if you have some kind of you draw the blood from the patient, if there's anything that hasn't been picked up by physical examination or kind of a new medical issue that we don't know about that's just has been silent, some of these patients can have like a low blood pressure, right? So when I donate blood, the nurse always tells you to stay in the building for 10-15 minutes, just in case you feel woozy, you feel weak and things like that. And if that's the case, then they would check your blood pressure and they would give you fluids. And so that would be the same thing in our world as well. So those are probably the biggest drawbacks for these donors.
How often can a pet donate?
There's a lot of discussion on that in the world of blood collection. Most of us, as a consensus, will say every 8 weeks is probably as much as we like to collect the patients. And some of that is because if you collect too frequently, then you end up with a patient that has difficulty regenerating because they become iron deficient. So there's a little bit of research in that says that maybe more than 8 weeks would be fine. But the reality is that we also don't want to bound any owners of a pet to come to the hospital every 4 weeks, right? We really don't want to make this a burden on anyone. So for our hospital and our program, we are shooting for about every 10 weeks is what we'd like for people to donate. And then if there's a critical blood need, it's safe to do it more frequently than that until we have enough donors or until the demand decreases.
How is the donated blood stored and how long is it viable?
Yeah, so there's a lot of processing that you can do with that blood. So if you collect a bag of blood, from the patient directly and you do nothing with it, it is stored as what's called whole blood. It's not separated. That can be kept in the fridge. It depends a little bit on which anticoagulant preservative you're going to use, but the most common one is going to give you roughly 28 days of refrigerated storage, which is pretty good. We typically go by use that blood much quicker than that, but you can also take that blood and separate it into the blood cell part and the plasma part. And that blood cell part should be good in the refrigerator for somewhere between 35 and 42 days, which is great. And then the plasma part of it, you can freeze and it will be good for up to 5 years, depending on which molecules you need to survive in the blood. So it becomes what's called a fresh frozen plasma for 1 year. But after that, for the 4 years after that, it's still good as standard plasma. And so a lot of hospitals are able to do that. You need a few special pieces of equipment to separate the blood, which we hope that in the future we can get. But it does give you a lot more options once you do have that.
Can you share a story? I'm sure you can. You've seen so many pets come through the hospital, but can you share a story where a donation of blood helped a patient?
Yeah, absolutely. I think it's almost hard to pick examples because it's almost a weekly thing. But there's always some cases that kind of stick with you for sure. And you always hear in patients whether, maybe during labor, they had a life-threatening hemorrhage and they needed 15, 20 units of blood to survive and those kinds of things. And so in our world, I mean, one patient that I remember for sure was a cute little dachshund that had a bone marrow disease, actually. So there was bone marrow disease that needed medications to allow the bone marrow to function again. And so this patient was transfusion dependent for 3 months. And so every 2 to 3 weeks needed a blood transfusion just to keep the patient alive. But eventually the drug started to work and then we didn't have to transfuse that patient anymore. And it was neat because, of course, it wasn't a very old patient. It was 4, maybe 5 years old. And so the owners were really dedicated. Had we not had a really robust blood bank where that location was, this patient would have never survived. And so I think it's cool because there's a lot of diseases that can be survived if you support them with a transfusion long enough.
If somebody is interested in enrolling, what does Partners program look like and how do people go about enrolling?
So just recently, our hospital, because again, the massive need and the, sometimes inability to have the products that we need to save a patient, we started a few months ago our own blood donor program, which is the NOVA blood banking program, NOVA standing for the Network of Veterinary Angels. And if anybody is interested in enrolling donors, I would say the first step is going to be to just contact us. So call the hospital, leave us a message at the NOVA blood banking program or email us, and then we'll get back to you and we'll set up a time either in person or by phone, whichever you choose, and we can go about the whole process, the whole screening, the whole requirements, sort of what we provide as perks and what we expect in return from the owner and the pet as well, and the risks and the benefits as well. So we really want to make this a stress-free, rewarding experience for both the owners and the pets that are donating as well. And so the last thing we want is if there's any question, anybody can ask, and then we're happy to enroll any patients that are, meeting the criteria for that.
We have an upcoming human blood drive. How will that look and how will that translate into the dog and cat blood donating program?
Yeah, so we wanted to, as part of kind of the startup of our blood banking program, our NOVA blood bank, and starting to recruit pets that are outside of the hospital employee pet family, we wanted to do kind of something neat at the same time and partner being involved with the community in any way that they can. We decided to do a human blood drive because that's going to help a lot of humans at the same time, but we thought that would be a really neat opportunity to also advertise and just give information to anybody about canine and feline blood banking as well, because then maybe we're able to educate people, and maybe we'll find some people with some interest in volunteering their animal and joining our program. So it was just seems like a kind of win-win situation for all the species involved. It's going to be appointment based. And so once a patient is accepted into the donor program after the screening process, we just keep a list of our available donors and when they're able to donate. And what we try to do is balance keeping our blood supply available without collecting too many donors, because the last thing we want is also to collect blood bags and not have them used, right? And so what's going to happen is we're going to, with our program, try to balance that and then just call whatever donor would be next on the list as eligible to donate and try to set up a time that works for everybody involved. And then if that doesn't quite work, we'll go to the next donor and come back and things like that. So it's a pretty stress-free thing. If somebody can't make their suggested appointment, we'll find some other time. It's not a big deal. So it's all going to be appointment-based. Yeah.
Okay. And I know I've heard you say a couple of times that there are perks for owners and their pets who do become a part of the program. Can you go over what those perks are?
Yeah. So, what's interesting is that in the human world, they found that any kind of monetary incentives doesn't really make a big difference in who volunteers in giving blood, because it turns out that, as you would expect, the people that do it much more like altruistic intentions. But we still wanted to do something nice for our donors. And so some of the things that are, I think, really nice for our donors, because owners don't have to pay for that, is other than being blood typed for free, obviously, you get annual blood work that we pay for, which is always nice for pets. We also provide vaccinations and prophylactics, so heartworm medications and deworming, because our donors have to be on a strict regimen without skipping any months. We want to make sure they have that access. And so we actually will supply that at no cost to the owners. And then the last thing that our management was kind enough to offer is that for any active donors that have donated roughly in the last 6 months, if something were to happen to them and they needed our hospital services as an emergency, they get a small discount of that as well. So there's a lot of perks that are really nice. And then the last thing is, sometimes if owners are okay with it, be having their dog or cat on social media as little blood donor heroes as well.
Yeah. I love that, as I handle the social media. So
yeah, right.
And I mean, those are wonderful perks, because getting, your blood work done and those preventatives, they can be quite costly. So those are really nice perks. And also knowing that you're helping another animal in need that's pretty cool.
I think that's, my experience has been that that's what most people want for it. I mean, it's nice to have the perks, but most people, they just feel good about doing it. And a lot of people actually do it because they know a human family member, friend, or anything that was in a situation that they needed multiple transfusions. And then once they know that our program exists, you would want to join. You want your dog to help too, right? So it's really cute the way that people come about it.
I love that. If somebody wanted to do this, but they are not local, where would you recommend that they look for a donor program in their area?
Yeah, it's definitely very regionally based, and the bigger centers will always have the most available blood donor program. And what my suggestion would be, if you're not in the area and you're kind of too far for our blood banking suggestions, I would talk to your local, either your family vets or maybe probably more easily your local ER or referral hospital, because chances are either they have their own program or they can point you in the direction of the big regional suppliers. That all those guys do is to have a huge program that enroll cats and dogs to collect blood. So they're not affiliated with a specific hospital every single time. They would just have donation centers, just like in the human world, and their entire business practice is to collect that blood, and then they ship it out to any hospital who make requests. But again, the issue is, and it's great if they can do that, because then they could help whoever it is that needs the blood. Yeah.
And then lastly, if somebody's on the fence about doing this with one of their pets, what would you tell them?
I would say that if you're on the fence and if it's a question of you don't have enough information or you're anxious about something, I would say just talk to us, right? I mean, come ask questions, meet us in person, see what kind of setup. We're happy to show you things like pictures and the process. And if at the end of all the information, you're still anxious and not sure about it, then I would say just take some time to think about it. Because again, we just don't want people to be anxious or animals to be anxious. We want people that say, you know what, that sounds great. I think you guys are taking all the precautions that you can so that thing goes smoothly, as stress-free as we can, and everything usually goes well, and then everybody involved feels great about it. But I would say if there's any apprehensions, you can definitely just talk to us, and if we can't make you feel more comfortable, then maybe you just think about it for a little bit longer.
Thank you so much for taking the time to talk about this with us. It's a really important program, and thank you for taking the time to chat.
Oh, my absolute pleasure. Well, I hope to see some new donors in the future, and I hope we get lots of questions that we can answer.
Thank you for listening to Did You Know? Is there something about Partner that you want to know? Email us at letstalk@partnervesc.com. Who knows, we might turn your question into an entire episode. You can now find us wherever you listen to all of your other favorite podcasts. Subscribe now.